Degenerative disc disease of the lumbar spine. What is degenerative disc disease? It's basically wear and tear, osteoarthritis, aging. It's what happens to all of us. It's just that degenerative disc disease is wear and tear of the disc itself. Here are the discs. This is the lumbar spine. These are the vertebra. This is the front, the back. These are the vertebra. These are the discs in the middle. The vertebra is what's numbered. The vertebra are L1, L2, L3, L4, L5, and then S1, S2. S means sacrum, L means lumbar. The discs are in the middle. So the discs have two numbers. This disc is L1, L2 because it's in between the 1 and 2 vertebra. The disc down at the bottom is L5S1. It's at the transition from the lumbar to the sacrum. It's in between L5 and S1, so it's called L5S1. So the disc is a moving part, and it's made up of two different components. The center part is the nucleus pulposus. It's watery, shock-absorbing, gelatinous, all the running, axial loading, it all goes through that nucleus. It's an amazing device. Imagine all the pounding that your body takes and these discs take every day of your life. That's the inner part of the disc. On the MRI, that's the white part on the T2 images that you can see. As the discs degenerate, you lose some of that water content. The discs will get darker on the MRI. Desiccation means loss of some of the water content. It happens in every tissue in our body. We lose water as we get older. That's part of the aging degenerative process of the disc. The nucleus loses some of its water. It gets darker on the MRI. The outer part of the disc is the annulus fibrosus. It's this tough woven basket. It provides all the rotation and torsion and stress through the vertebra through your whole life. And that's an amazingly strong structure. People get surprised when they get back pain and they get degenerative changes. I'm shocked that we all don't get it earlier. These discs are the workhorse of the spine, of our whole body. Everything we do goes through the disc. It's amazing they last as long as they do. Degenerative disc disease, it typically starts around age 28. 28 is when we reach our peak as humans, and it's kind of all downhill from there. We used to die around age 50, so it all kind of worked out. Now we're so smart, we live till we're 80, 90, 100 years old because we take good care of our other organs. The problem is these discs are just wearing out that whole time. What can you do about it? Non-operatively, get your core strong. Get the muscle strong. Use our Back Doctor app, which is free in the App Store and Google Play Store. If you get these muscles strong, you can take some stress off the discs and decrease the pain coming from the discs. If that doesn't work, the surgical options are to do a fusion or an artificial disc replacement, and those are in the next videos. How does degenerative disc disease pain present? How do you know if that's your problem? It's just like any other osteoarthritic wear and tear type of pain. You wake up in the morning and you're stiff. Your back is stiff, it hurts when you move. It takes about 20 to 30 minutes, maybe a hot shower, to loosen up until the disc gets lubricated and it starts to move better and function better. The water comes back into it and you feel better after about 30 minutes, it loosens up. Then the second way to know is, towards the end of the day, the more you have used your spine and put stress through that disc by lifting and carrying and working in the yard and doing active things with your back, it'll hurt more. And so mechanical activity can provoke the pain. And the more you can do, the more it can add up through the day. Those two things, the stiffness and pain in the morning that loosens up, and then more stiffness and pain towards the end of the day, the more active you've been, are typical for degenerative disc disease pain. Also, where do you feel it? Basically in your lower back. It can go into your SI joints, into your buttocks, into your hip. It does not go down the leg below the knee. That's when we know it's more nerve pain. But it can go into your butt and your whole lower back, that whole area. Any disc in your spine can cause pain anywhere in that general area of your back and your buttocks. So it's very non-specific. People always point to one spot and say, this is my L4, L5. They don't match well. Our job would be easier if it did, but they don't match well. Any disc can cause pain anywhere in your lower back. But that's the typical pain from degenerative disc disease. You have two options at this point. If that's what you think you have and you want us to take care of you, feel free to email us at info@watkinsspine.com and we'll get back to you. Or check out the next video, artificial disc replacement for the lumbar spine and fusion for the lumbar spine. Those are treatments for degenerative disc disease. Thank you.